Hello and welcome back to India Top Doctor. Today we are back with another episode of the Health Dialogue. And today we will talk about oral hygiene. We have talked about oral hygiene in our YouTube channel and Facebook page a lot. And if you haven't watched the videos, go check out our page now. Dental care and oral hygiene is really very important. It affects the overall health. To know more about this, today we have an expert on dental care, Dr. Priyanka, who is an expertise dentist in Dental Assure. So let's welcome her.
Sure. Hi everyone. I'm Dr. Priyanka Luthra. I'm a dentist. I have completed my journey of I have completed my degree in 2010 from JCD Dental College from Kurukshetra University. After that, I have done various courses on dental implants. So I'm a dental implantologist now. And later, after completing my degree, I started my career as a dentist in a charitable hospital, Sirsa. Then I moved to Bangalore and I have worked there in a renowned dental clinic. And then later I moved to Gurgaon, and since then I have started my own clinic named Dental Assure. It is in Sector 39 Gurgaon, and I'm running that from 2015 till now. It's a multi-specialty dental clinic in Gurgaon. We have various kind of patients here for their oral health, like for their oral problems, and they are from India as well as from overseas as well. We have various patients from Middle East companies, Middle East and Africa and Saudi Arabia. From there also we are getting patients.
All right, ma'am. So my next question would be, why did you choose dentistry?
Well, I am from a medical background only. My family, my mother and father, they both are in the same profession of health. My father is a general practitioner. My mother is in government health sector. She's working there. And my brother is a veterinary surgeon. So somehow I knew that I have to pursue my future in this same department because I have seen this communication with the patient and all those medical related things since my childhood only. So I was passionate about that. So after all those exams, I came to know about dentistry and I came here, landed up as being a dentist. Okay, so it's now I'm loving it because I love treating patients and making a beautiful smile.
Very well. I guess I can say that medical is in your blood, like literally.
Maybe that's why, because I have seen it from my childhood only, so I was passionate about health only.
Right. So
So
you would
somehow I came here being a dentist.
Right. So you would know the importance of hygiene, right? Can you tell our
Yeah.
audience about the importance of oral hygiene?
Okay. So oral hygiene is not only related to your mouth, it will reflect your overall health also. Okay. Because most, like when you take something, it starts from your mouth and it goes inside your body. So, whatever you will eat, if there are microorganisms, bacteria in your mouth, it will go to your body and it can harm any function, any organ in your body. Okay, so there are various diseases which are related to your mouth, which will affect your personality also, as there is bad breath, which starts from your mouth. There are gingival inflammations, bleeding from the gums, cavities, all those can lead to bad breath. So if some person is having a bad breath, whatever personality he carries, it doesn't suit him or her. Okay. So whenever you do some conversation with any person, there should be no bad breath that will affect your overall personality. Plus, there are several lesions which can be seen in the mouth, like related to diabetes. You will have gingival inflammation. Lesions of age, you can start looking it from your mouth only. And some heart diseases also, whenever the bacteria enter the blood and it goes to the heart, it can create blockage over there. So whatever is there in your mouth, that can affect your body. So if you keep your oral hygiene proper, all other diseases can be prevented. Okay, so it is well said that being investing in a good oral hygiene is a good investment for your overall health.
All
So you
right.
should maintain your oral hygiene properly to prevent all those diseases also.
Yes, absolutely, ma'am. And can you tell our audience like what causes tooth decay and how to prevent it? Because we have seen tooth decaying is like one of the most common diseases right now, presently
Correct.
too. So how to prevent that?
Ma'am, you have rightly said the tooth decay is the most common disease which is in your mouth. So to prevent that, it's simply your oral habits, your eating habits. Okay, stop eating sugary food. Very sugary food which sticks on your tooth, you should avoid that. Very processed foods like which is you can avoid taking acidic drinks, carbonated drinks. They also accumulated on your teeth and your teeth will get damaged due to them. Okay, and maintaining your proper hygiene, you can stop cavities with that also. And doing brushing twice a day is very mandatory. Snacking, frequently snacking, eating frequent snacks, and not rinsing your mouth properly. That can create cavities in your mouth by accumulation of plaque. Now, what is plaque? Plaque is something like a soft deposition on your teeth. Whatever you eat, it get deposit on your teeth. Then inside your teeth or on the in between the teeth, okay, on the gums line. So whatever you will eat, it will stay there. When you are taking any, you are when your saliva is not, the salivary flow is not too much, then this less of saliva, bad germs, plaque, they all get.
So sorry to interrupt again. Your voice again is echoing.
Okay. Sorry for that. Can you hear me now properly? I'll speak little slow.
Yeah, you can go a little bit slow because it's echoing. I don't know
Yeah.
why it's happening, but it's,
Okay. Now can you hear me?
yes, it's fine now.
Okay. So what happened when you eat something? There is deposition of food on your teeth. This food will create a very thin layer which is called plaque. Now, when the plaque is there in your mouth, it will mix with the saliva and germs that will create acid. Whatever you will eat, that mix with the plaque and create acid. That acid will affect on the teeth. Then your teeth enamel will get eroded and that will develop into the cavity. So you have to prevent that plaque to accumulate on your teeth. That you can prevent while eating. After eating, just rinse your mouth thoroughly with the water. After every meal, you can rinse your mouth and brush twice a day. So you have to just stop that plaque to get accumulated on your teeth. That will eventually lead the bacteria not to get accumulated on your teeth and not to release that acid which can affect on your teeth and create cavity. So basically your dietary habits, smoking, and sticky food, processed food, carbonated drinks, brushing, all these things, if you will take care of them, there will be no cavities. Plus, there should be dental visit every 6 months to check if there are initial cavities or if you need cleaning to remove that plaque. That should also be done to prevent further decaying of teeth. When there is plaque, slowly it gets converted into a calcified hard deposition, which is called calculus. The calculus is something which can't be removed with brush, that is called tartar. So you have to go to your dentist to remove that tartar. That again will create cavities if it is there on your teeth. Plus, it will create the inflammation of your gingiva, the gums. Then you will have the bleeding on brushing and all those problems will start if there is tartar on your teeth. So, best is to maintain your dietary habits to Maintain your oral hygiene while brushing and visit your dentist every 6 months.
That was really a detailed information on this problem, and I guess it really had an impact on our audience. So,
Yes,
doctor, you
ma'am.
said that you were an expertise in implantology. Can you
Yes.
tell me when one should consider dental implants?
Okay. So basically, you need to know first what is dental implant. It
Right.
is a kind of metal post. I'll show you in a model. It is a kind of metal post which will go inside the bone where you have missing tooth. Okay, this will get combined with the bone and make a hold over there, and later it can be replaced with a crown on that area. Okay, so dental implant is a metal screw which will replace the root portion of your tooth, and later that can be replaced as a tooth by placing the crown on that area. There you can get a new tooth. It is basically a replacement of your missing tooth.
Okay. And we just discussed about tooth decay, how it is the most common, one of the most common seen diseases. Can you tell me, other than that, what are the other most common seen diseases in teeth and gums even?
Ma'am, most common is dental decay. Other than that are calculus, which I have told you. After plaque, you will get a deposition which will become hard and become calculus. That will lead to your gingival inflammation, periodontitis, which is like shaking of your teeth. If you'll get periodontitis, that means your tooth and your gums, they get accumulated with calculus. So that calculus will again affect on the gums and the bone. So your tooth is inside the bone. If the bone will start getting weakened up, your tooth will start shaking. So that will lead to the missing tooth. Your tooth will come out. It have to go for extraction. It will start shaking. So main diseases will be calculus, dental caries, bleeding from the gum, and there are major things like if your cavity become more deep, then it will lead to root canal treatment. And if your periodontitis will occur, that will be missing tooth, then you have to go for replacement of tooth.
Fine. Ma'am, a study has shown that a lots of people they face like dental anxiety, right? People fear when they to go to a dentist, and there is still so many myths about going to a dentist. So can you give a message to our viewers and help them overcome it?
Ma'am, actually, dental anxiety starts if you are going for the first time to dentist. That's why I've told you make a regular visit to your dentist. If you will go for regular checkup, if you don't have any problem in your tooth, if you don't have any pain in your oral cavity, you will not be that much anxious that oh, I will go to the dentist and I will have pain because my pain is already there. So make a regular visit to the dentist. When you will go to the dental clinic for normal procedure like dental checkup or dental cleaning, which is completely pain-free process, then you will become familiar to the dental environment. You will become familiar to your dentist. You might become a good friend with your dentist. So whenever you feel like there is a major problem, now I have to go for a filling, or I have to go for root canal treatment, or I have to go for implant, you will not become anxious because you are already familiar to the place. You are already familiar to that dentist. Okay, you know how they work, how the place is there, how you have already been there, and how's your past experience. So you will not become anxious. Plus, there are many dental camps also which will educate you about your treatment plans. Okay, don't worry, all the treatment plans are pain free, all the treatment procedures are pain free. Even if you are going for root canal treatment, the first thing which comes in patient mind is that it will be a very painful process. It's not like that. Root canal treatment is a pain free process, dental implant is a pain free process. They'll give you anesthesia, make that area completely completely numb. You will not feel any kind of pain if you are going for any dental treatment. So anxiety and myths are in their mind only. You have to overcome that by visiting to your dentist. There are few myths related to dental cleaning also. Like if I will go for dental cleaning once in 6 months, as I have advised, my teeth will become weak. It's not like that. If you will go for dental clinic regularly, your teeth will not become weak, even they will become stronger, because the calculus which we are removing from your teeth with scaling process, that leads to the weakness of the teeth. When we remove the calculus, which was in between your gums, which was in between the gums and the tooth, when we remove the calculus, you feel your teeth has become weakened. But it's not like that. When we remove the calculus, they will start bonding on the tooth and the gums. That will make your teeth stronger. They will not become weak. So go for a regular checkup to your dentist, and not only the adult, I will advise for the kids also. Take your kids to dental center, a dental clinic on a regular basis. Now, what happened in the kids? Uh, when the baby take birth, there is no teeth in their mouth.
Right.
So you should start the cleaning of their gum pad. When there is no tooth, there are gum pads. You should start that cleaning from the very first day. When they are taking breast milk or they are taking any kind of milk or any kind of solid or semi-solid, you start cleaning them with a wet cotton. Clean wet cotton, just wipe on their gum pads. That will not leave any kind of food residue or any sugary content on the gums. So when their teeth will erupt, that will not harm the teeth. Some people think that it's just baby teeth which will shed. Later, the permanent teeth will come. So, why we should take so much care of baby teeth, or why we should go for filling or even root canal treatment for baby's teeth when the permanent teeth are eventually coming? But it's not like that. When your baby's teeth will be good, healthy, then only your permanent teeth will come in its place or they will become healthy teeth. So later you should not have any problem. Start from the day when the teeth will erupt. Start cleaning your baby's teeth. If there are no teeth, only cotton will help. If there are first tooth, whenever the first tooth will come, there are some soft brush available in market. Clean the teeth with those soft brushes without toothpaste. Okay, so you have to just keep this thing in mind. You have to make sure the teeth of your baby should be clean so that they can have a healthy permanent dentition. And your baby's visit should also be there once in 6 months or within 6 months or after a year at least when the first permanent tooth will erupt. So both the dentition, whether it's a deciduous dentition or a permanent dentition, whether it's baby's teeth or permanent adult teeth, both of them equally should be taken care and maintain proper oral hygiene.
Thank you, ma'am, for an eye-opening message.
You're
So,
welcome, ma'am.
we just talked about how teeth are a part of our beauty, right? And we have
Right.
skincare routines and hair care routines. Can you tell our audience about teeth care routine?
Teeth care routine. Okay. The first thing on teeth care routine starts with your diet only, as I have told you already. Less of sugary foods, less of processed foods, more of fruits you should have in your diet, more of fibrous items you should have in your diet. Instead of going for juice, just go for the fibrous items. Direct start eating fruits directly instead of making a juice of the fruits. And avoid smoking, avoid alcohol, drink plenty of water, less of tea, coffee. Okay, that will again lead to on the plaque, that will again lead to the stains, and then you have to go for dental cleaning. Visit your dentist once in 6 months or at least once in a year. Brushing twice a day, morning and in night. Yeah, this is also there in patient's mind that we should brush only in morning, no need of brushing in night. When we brush in night, there is when we don't brush in night, there is less of salivary flow when we sleep. Okay, so whatever you will eat, that will accumulate it on your teeth. Plus, the salivary flow is less. So, cleaning is not there properly. Plus, your tongue movement is very less at the time of sleeping. So, when your tongue movement is not there, your teeth are not getting cleaned. Whatever you will eat, that will stick onto the teeth. And then microorganisms will do their job. In the morning, when you are brushing, that is only for the freshness of your mouth. That is not for cleaning of your teeth. So it is ideally suggested that you brush your teeth in the night before sleeping, before going to the bed. After your meal and after eating everything, just brush your teeth properly. In the morning, if you will brush again, brush after your breakfast. After getting up, you can just rinse your mouth with normal water or with warm saline rinses, which is warm water with a pinch of salt in it, and rinse your mouth. That is very good for your cleaning purpose of your teeth, for gums, making your gums healthy. Okay, so rinse your mouth and then take breakfast. And after breakfast, if you will do brushing, that will keep your oral hygiene really good, and you need not to go for any dental procedures in future. That is the preventive to control your dental caries and your dental problems.
All right.
So just maintain all those things, then there will be no anxiety of visiting to the dentist because there will be no caries in your mouth.
Right. That was so great. My last question would be that you are a frontline worker, that to a dentist. So most of your patients you have to deal with the mouth. You have to deal with mouth where the virus lies the most, and you know how COVID cases are increasing. So how are you
Yeah.
taking precautions for you and your family's safety?
Yeah, that is very tough for a dentist because in COVID, especially, everything is related to mouth, nose, and eyes. So that is in very close contact to a dentist. For that, for taking care of our patients, we use PP kit for every patient. There is a new PP kit we are using. Double mask safety for our safety and for patient safety. We are using face shields to prevent. There are some DCI guidelines which we follow. We have to follow the dental guidelines to treat our patient. And now, like COVID is now normal thing for us. We are not able to prevent ourselves, whatever we do, but still we are taking proper care for ourselves and for our patients. We properly fumigate the clinics to remove all the aerosols. Like previously, there are waiting patients and all those things. Now we keep a gap in between patients. Like if first patient we are doing, we keep a gap of half an hour or an hour for the next patient so that we can properly sanitize our clinic before the next patient arrives, so that all the aerosols we can remove from the clinic when the next patient arrives. And for ourselves and for our family, definitely that is a challenge. Whenever we finish our work in the clinic, take proper removal of the PP kit, disposal of the PP kit, sanitizing our clothes with the spray sanitizer and all those things. We take that care in the clinic. When we go home, we take a proper shower and proper washing of the clothes. Then only we go to meet our family members so that we can avoid any kind of spreading of virus from us to our family members. That is a challenge, but we have to deal with it.
Yeah, right. It was great talking to you, ma'am. Thank you so much for taking our
Same
time from
here,
your
ma'am.
busy schedule and be with us.
Thank you. Thank you for having me here. Thank you. It
Thank you.
was very nice meeting you, ma'am.
You too, ma'am. And if you guys want to book an appointment to talk to Priyanka Luthra, you can do the same by visiting India Top Doctor. And for many more videos, keep following India Top Doctor. Thank you.